Once I made my decision, I never looked back, and it has been one of the most wonderful experiences of my life. It is exciting. It's like a gift. Well, I had taken care of patients who had had Roux-en-Y, the so-called gastric bypass, and oftentimes those turn into real disasters. If not in the immediate post-op period, then further on down the road. And it was something I would never have considered doing for myself. The lap band is a relatively benign procedure. It's done laparoscopically. It can have complications, but they are rare. People don't have their insides rearranged and rerouted. They can eat normally and digest normally. And I just felt that that was a very important, thing. I did not want to change what nature had put together. But I needed to do something, and I needed to do something quickly because I was at a point where I could not walk anymore. My joints were hurting so much. I would spend a 10-hour shift at the hospital, and I would cry all the way to the car. All that has changed for me. I was banded in January of '06. I came back down in October of the same year. By that time, I had lost almost 100 pounds. And Dr. Kuri took one look at me and said, "Oh my God, you have your life back." And truer words were never spoken. I had my life back. So I kept bringing my fellow ICU nurses down to get banded. And finally, Dr. Kuri called me and said, "You probably should be working for me since you're coming down here anyway." So I did accept a position as a facilitator with him, and I've been loving it, loving every minute of it. It's very important that they know how this works and why it works. I've lost 105 pounds, the first 100 in the first 10 and a half months. It was very quick, but I don't consider any surgery benign. And I looked at this as something that was very serious, and if I was going to do it, I was going to do it correctly. I actually started out at 283 when I decided to have this surgery, but I made a commitment that I was not going to have any last suppers, and I was able to lose down to 265 and a half pounds the day before surgery. Now I'm 160. It makes a big difference, I think. It's part of that attitude adjustment that you need to make when you decide to use the lap band, because it is a tool. It's not magic. Although there are times when I look back on this and it seems like it to me, but it's not. It's just a tool. And if you don't use that tool correctly, it doesn't work as well for you. A lot of surgeons are out there. They're not giving their patients the information that they need to be successful. So I see my role as making sure that these prospective patients have all the information necessary to not only make the decision to get the band, but to be aware and know exactly what they're going to need to do afterwards. And we have a patient educator on the Dr. Kuri team who has written some fabulous information sheets. These are all given to the patients in a timely fashion, in a certain order, once they decide that they need to come down and be banded. One of the reasons that I chose to go to Mexico was because everything's so clean down here. The Hospital Angeles, where he does the surgery, is absolutely state-of-the-art. They have every piece of equipment that you could ever ask for, intensive care units, beautiful operating rooms. I don't hesitate to recommend it to anybody. And like I said in the beginning of this piece, I kept dragging my fellow ICU nurses down to get banded, and they felt very much the same. They all said the same thing to me afterwards. "You told me it was going to be so wonderful and so clean and so marvelous, and we believed you because you're you, but to see it is just amazing." And they said they could hardly believe it. I look at this facilitating experience as the highlight of my nursing career, actually. It's the culmination of a lot of things that I was being prepared for through all these years. And the patients that I have been able to talk to are fabulous. They call this the thinking man surgery. And I'm always amazed at how many people come to it having already done a lot of research and a lot of groundwork and do have an understanding of what needs to be happening for them and what their role is in it. And if not, then that's one of my jobs, is to prepare them for it. To know Dr. Kuri is to love him. He is not only a magnificent surgeon, but he's a fine human being, and he truly cares about his patients. He doesn't forget them. He sees people that he hasn't seen for a couple of years, and it's like he saw them yesterday. That's amazing to me, considering the number of patients that come through here. He's always here for you any time of the day or night. It's just a different way of approaching medicine that they have here, and it's delightful. I would not trade my band for anything. I wouldn't trade my experience with Dr. Kuri and the team for anything.